Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Myocardial infarction. So first we will see the myocardial infarction classification. We have 5 types of myocardial infarction. Type 1. In type 1 we have spontaneous myocardial infarction, mainly due to this spontaneous myocardial infarction is related to ischemia due to a primary coronary event. Here the ischemia is due to a primary coronary event, like it is either due to a plaque erosion. There is primary spontaneous myocardial infarction which is related to ischemia, and this ischemia is due to primary coronary event like plaque erosion or rupture, or it can be due to fissuring, or it can be due to a dissection. Then we have type 2. In type 2 actually we have MI. This MI is actually secondary to ischemia. Here there is an MI which is secondary to ischemia, mainly due to increased oxygen demand, which is due to increased oxygen demand or decreased supply. Like for example, the MI in type 2 is mainly because of increased oxygen demand or decreased supply. Like for example, if there is a coronary spasm in the patient, then this coronary spasm will result in decreased supply because of constriction of the coronary arteries. So the distal part does not get adequate blood supply. So there is decreased supply, or it can be due to coronary embolism. The emboli blocking will also decrease the blood supply to the distal part. It can be due to anemias, or it can be due to arrhythmias or hypertension or hypotension. Okay, so all these are type 2 myocardial infarction. Then we have type 3 myocardial infarction. Okay, in type 3 myocardial infarction, here there is sudden unexpected cardiac death is seen in type 3 myocardial infarction. Then we have type 4 myocardial infarction. In type 4 myocardial infarction, there is a myocardial infarction which is associated with percutaneous transluminal coronary angiography. And we have type 4b. This is actually type 4a. We also have type 4b myocardial infarction. This type 4b myocardial infarction, it is actually a myocardial infarction which is associated with stent thrombosis. This is type 4b. Then we have type 5 myocardial infarction. Okay, in this type 5 myocardial infarction, here myocardial infarction is actually associated with coronary artery bypass grafting.
thank you and thank you for watching.